Hey guys, welcome to today's show. We're going to be talking about a subject that we've talked about here on the show a couple of times, but we want to dig a little bit deeper with our guest that we have today, who is none other than William M. Carroll Jr. He's going to be joining us and talking about the importance of PrEP and all of these different medications, and as well as caring for yourself when it comes to your sexual health. My co-host today, you've seen her on here before. She's my girl, none other than Kay, aka Karen Young. Cannot miss this episode. Stay tuned.
Trish Standley TV show.
Welcome to today's show. We are talking about the topic of HIV and just kind of, reviewing the narrative around that and also specifically the medication. So we have some expert voices on today's show that's going to join us. But first off, I have to introduce my co-host for today, which is none other than my girl, hey, Karen Young.
Yes,
she's been on here before, and you shared your story with your mom, Denise. And so we're going to get an update. But before we do that, I have to just give so much love and accolade to our guest today, because we've been communicating for quite some time.
A while.
And we finally got here.
I get to meet you.
He is none other than William M. Carroll Jr. Welcome to Trish Standley TV.
Thank you so much.
We're going to dive into the conversation about HIV. I can't wait for you to share your wisdom behind that. We have a lot of questions concerning specific areas of that.
Okay.
But before we do that, Karen, can you please share the update in your mom Denise's story?
Oh, yeah, gladly. So right now we are in what they call the discovery period. So at this point, he's been indicted on malice murder and felony murder for the death of my mother due to her contracting HIV and ultimately dying from AIDS, and her husband not telling her, of course. Mm-hmm. And so we've gone through all the steps, and he's been indicted. So now we're in what they call discovery period, where the district attorney is gathering all the evidence to share with the defense attorney, and then we'll begin trial. So hopefully all of that will happen this year.
Good. We're hoping and praying for that. There was an incident where he was able to make bail.
Yes.
But what happened around that situation?
Well, he had been incarcerated so long, for 2 years without even being indicted. So his attorney fought to get his bond reduced to a level that he can pay.
Okay.
And so his new attorney was able to get his bond dropped from $1.5 million to $450,000.
Okay.
And he was able to come up with, I guess, that $45,000 that he needed to be released. But he was only out probably for a month, about 30 days before the grand jury indicted him. And then they went and picked him back up. Okay. So he went right back to jail.
Yes. So we'll be definitely giving follow-up on that particular. I will plan to be in court a couple of days, or if I can, to just be there to support, but also but most of all, to be there as an advocate in this particular area for you. I'm advocating and supporting you in this area because you have become a social media person on this particular topic. Hence, we're bringing in William to come and kind of share some of his wisdom. I'll let you start out with any questions that you have, but before we do that, introduce yourself and just share whatever you want to share with us.
So once again, I'm William Carroll. I work in public health. I've been working in HIV. Actually, this month makes 8 years I worked in HIV. Previously, I've been working in public health probably since 2003. Started working with adolescent health, doing sex ed information, and that sex ed kind of transitioned into working in HIV and STD. So primarily my work is in preventive strategies to make sure that people avoid HIV and avoid other STDs. Okay. So that is where my strong house is with HIV and STDs.
Okay. And is there any particular reason why you chose that particular area of expertise? Because, you know, I know like some people will have passionate things, you know, or something that may happen within the family. Why this particular STD? Or it's all STDs,
It's all
right?
STDs.
Oh, okay,
And
okay.
so, like I was saying, so I started working in adolescence. So adolescence is going to always be my ground. It's going to always be the foundation. Anything that's going to help youth is going to always be something that I'm more passionate about. And so I feel like I was dragged into HIV because one of my friends was working in a program and was just like, hey, you'd be great working in our program. I said, well, I still have an opportunity to work with youth. Like, that's why we want you. It's like, okay, great. So that's how I got a chance to do it. So I've learned so much more and am able to provide more education and information and preventative strategies to young people. And so that was the main thing. So I've had, and it was years ago, I had a relative that got HIV from her husband, and she passed, but I didn't know her that well. I knew her children. I knew her mom and dad. And so when I found that out, it was like, okay, that was more than I expected. And since then, have found other relatives who have got HIV. So being able to hold conversations with them and being able to, you know, double check, like, okay, so is this the same thing that you have to deal with? Has been something that's been beneficial to me for just as far as a learning and a knowing type situation.
Yeah, so it's kind of interesting. We're always talking about my mother's case and HIV and the things I learned because a lot of people reach out on social media to me about HIV. And speaking about the treatment and the educating the women, the children, especially the young adults on preventative ways, do you share that information in pamphlets to the schools? Are you just you're trying to meet them where they at? So a
lot of times it's trying to meet them where they are. In school systems, it's almost like they want to say kids are not having sex. So a lot of times it's just like to bring in and hold conversations along those lines. In many cases, well, we don't want to do that. So if I'm able to come into schools, it's, hey, can you talk about these diseases, but, you know, don't talk about condoms. Okay, come in, don't talk about, you know, safe sex. Can we just talk about, and like, I'll get permission if the kids are asking me questions. Then I'm free to be able to discuss those different things. But beyond that, like, there are some very progressive school districts. There were some very progressive churches, after school programs where we can go and hold conversations and it's not a challenge. It might be some slight pushback because they are still having their messages that they want to give by. And I always try to encourage parents, you all should be the first line of defense. You should be the ones talking to your youth about diseases, sex, and everything. I should just be a resource to you to be able to provide information, some training if that's needed. So even when I'm doing the sex ed classes, it's, hey, talking to the youth, you know, I'm just providing you information. Take this information back to your parents and see what their thought processes are about this. Get what their values, because I don't give values. I can just tell you what information is out there and try to provide you with ways to disseminate that information to your kids.
Yeah, see, I have sons, so we had the sex education talk, and prior to my mom, I have to admit that I really didn't focus on HIV and AIDS with them. It was more of the common things that they already knew about, like, oh, you can get gonorrhea or chlamydia, herpes, and those type things. HIV wasn't on the top of my list of discussion. And I think people, a lot of people stigmatize the HIV thing and try to think that it's only a LGBTQ plus diagnosis. And it's not, because those people, they talk about HIV. You know, they're comfortable with that conversation with each other. So it has become a problem for more heterosexual people than it has for
and more so for women than anybody else, because the conversation is typically, oh, well, that's affecting somebody else. We're not worried about this. This is my husband and I'm his wife and I'm not having to deal with that. But the rates are going higher for heterosexual women. So we have to make sure that the conversation becomes more prevalent. Holding a conversation before I came here today, I'm talking to a relative and they're just like, you got more people who are more afraid of the stigma that's attached to a herpes diagnosis than an HIV. But and you know, even with that, it's like people are still talking about HIV. That's the conversation, of course, that we end up having with a lot of people.
You know, I was sharing with Karen, was it yesterday? I think it was, that the very first HIV case, AIDS case, I'll say, first HIV/AIDS case was Ryan White, a little white boy in Indiana. And the reason why I'm familiar with it is because I'm from Indiana, and I remember the media around all of that. That was not a heterosexual situation. This was a little boy. And so some kind of way, where did we get this, that it's only for those who are gay? And I just don't understand that. And so I think we're still stuck at that place.
Absolutely.
And it's affecting the other remnant of people. And so I just, for me, like you mentioned, the stigma is the stigma. Because we were talking about even that. When it was a time when you used to had to have blood tests to get married. They took that away. We don't have to do that anymore. How is it, if you sneaking and creeping, you're already dishonest. What makes me think you're going to be honest with me, that you're out there and then you're not protecting yourself? And so it's a stigma, but it's also something I feel like the doctor should come back somewhat. And you kind of touched on that. You can expound on it. I think it's something that it's should happen again in the doctor's office.
I think that it should not. The burden to carry for that diagnosis is so heavy for the person who has to carry it, and I don't think it's a weight that they should have to carry on their own. Even though they have to live with it, I really think that their doctors should have some way to identify that their patient is HIV positive, and that I know HIPAA protects that. And maybe you can speak more on the level or how much of it HIPAA does protect. Because a lot of women, they go to the doctor with their husband or potential husband, fiance, and they're going to make sure they're both safe. We're going to go take HIV tests, STD tests, and make sure we're good. Well, they sit in front of the doctor, and one of us could have a diagnosis that is positive and one can have negative. And we could lie and say we're both negative, but the doctor couldn't intervene to say, wait a minute, now that ain't what that test said. So what other way?
I mean,
what else
it's a challenge. Because like even doing the prevention, we go out and we do mobile testing. We go out in the communities and testing people. And when we're out and you see the expressions on people when it's just like, we're providing free testing. Well, I'm married, I don't have to worry about that. Like, no, you have to worry about like everybody else. You hope that when you get into a relationship that person is going to care enough about you as much as they say they care about you. You hope that they're going to keep your health in mind, but that's not true in many cases. So we tell people, first and foremost, know your status first. You know your status, you know how to take care of yourself. You hope that in the course of a relationship, the person that you have decide to be with, that, hey, we've developed a foundation of communication, being honest with one another, and that I'm going to let you know what's going on. But we know that that's not always true.
It's rarely true.
It's rarely true. So it's important for us to be mindful of our health. We try to encourage everybody, regardless of status of marriage or whatever, get tested every year. Because outside of sex, if people are getting piercings, if they're getting tattoos, if they work in the medical industry, they could get a stick and end up becoming positive. So it doesn't have to be something that somebody is getting because of infidelity. But hey, let's just do those things to protect our relationship. Make it a part of the relationship. As you're getting started, hey, well, I try to make sure I get tested once a year. Let's just go ahead and let's do that. Because go ahead.
And even speaking on that, going to the when you go to the doctor to get your annual, you know, you have to be specific. Test me for this. Instead of it being a part of that. And then in some cases, I had heard that you got to pay out of pocket for it. I think that is so ridiculous.
It is.
I know for most of the organizations that I get a chance to work with, they free tests. You can come to a health department and get a free test. You can go, you can see different organizations, because this month is National HIV Testing Day is on the 27th of this month. You can go to a Walgreens and get tested for free. So there are places that people can get tested for free, no charge. and you know what your status is.
Yeah.
Okay, now we gonna go into that test. Remember, we talk all the time because this is my walk buddy. But remember when we were talking and you mentioned the different types of tests. Like there's some tests that.
Well, the blood test or a urine test, right?
Blood is the only way that you can test for HIV.
It is.
Okay.
Right.
So the Walmart test, as opposed to going to the doctor and actually, what is it, PCR? PrEP.
Okay.
You know, when you go buy an over-the-counter test from Walmart and
versus going to a lab and getting a full blood draw. Many times, like when we're doing outreach testing, some of those same testing apparatus, we can go to a Walmart and purchase. So some of the same companies are putting these out. The difference is if you go to a Walmart and get it, you're paying $40 and $50 versus being able to order some stuff from the state. The state has health kits that you can get. Some are oral swabs. Some are tests that test for 5 different STDs that's there that you can order and get sent to you for free. Same test, you go to a Walmart or to another store and you have to pay $40 or $50 for it. Now, I will say a blood test, whether it's a full blood or just a finger prick, is going to be a little bit more specific, and you get a result that I don't want to say that you can trust more, but you'll feel better about it than just an oral swab, because there are different things that can get in the way of an oral swab. I'm still saying an oral swab can be good, but just know that there are different things that can throw off that testing method as well.
But okay, so if you're undetectable, you're on your drugs and you're undetectable, and we're engaged, I'm your fiance, and I want to know your status, and you say, yeah, let's go to Walmart and get some tests. And so now your test shows you're negative when you're really not negative. You still have HIV.
So the hope is, and once again, we're dealing with hopes and dreams here, that when people get in relationships, that people express, hey, this is what I'm dealing with. So you get a chance to decide if you want to continue that relationship.
Exactly.
But, stuff happens.
And
So basically the Walmart tests are the mouth swabs.
Mouth swabs, and I have not looked recently to see if the finger stick tests are there. But I do know, like I was saying, that if they've got the 5-in-1 like the state provides, that it's a finger stick. You send for that one, because it tests for multiple STDs and HIV. It's a blood stick and it's a urine sample that you send off to an independent lab, and then they send the results back to you. If it's positive on anything, they will suggest that you go to either a health department or go to your medical professional to get a full panel or treatment to make sure that you stay healthy in that particular regard.
So in my mind, still, that Walmart test is false.
You feel like it's false?
Because you have it.
Yes,
even though the test is saying you're negative, you're not negative. You're just undetectable.
Right.
So I wouldn't recommend a new relationship to go to Walmart and get a test with their partner to see if you got HIV and make sure we're clean. Don't test that. You need to go get a blood test, because once they get a blood test from the doctor, even if they're on their medication,
it should,
but
But the level of medications that there are now, and getting to that undetectable level, like an initial full panel of blood might not still show it.
Really?
Because the medications are that good. And even if and I don't want to, make it seem like it's a great thing. If that person is taking their medication and they are doing it as prescribed, that undetectable should mean that it shouldn't be transmitted to them. The medications that are now, if people are adhering to their medications, they should not transmit it to someone. So even with somebody who does not, and so we're talking about methods of prevention, there's PrEP, and it's the same thing. If people are following the system the way it's designed, you should not get HIV. And I call it PrEP a system because not only are there medications that's prescribed for it, but it's also blood work that you're constantly going to make sure that your liver function is functioning, your kidneys are still functioning, and to make sure that you're not contracting any other STD that's there. So somebody's on PrEP and their partner is on an antiretroviral therapy medication, they shouldn't transmit it to each other.
So PrEP is an actual medication. It's a pill you got to take.
It's a system because you got different medications that fall under PrEP. Amplitude is an injectable. You've got Descovy. You also have Truvada medication. That those are pills, and the pills you can take. You take once a day, every day. Just think about it like when people are taking birth control. You're taking it in order to not get HIV. The injectable, it's once every 2 months, and it prevents you from getting HIV. But like I said, the system is that you have to go and get lab work done. You have to make sure that the medication is not damaging your body. You have to make sure that you're not coming in contact with any other STD at the same time. So you want to make sure that you're following that. And so if people are in doubt, then it's just like, hey, the medications that can help prevent them from getting it. But once again, we have to get to a point where people are communicating, communicating the hard things. And a lot of times people are afraid that they're not going to be able to have the life that they want. But like I said, when we're out and we're talking to people about knowing their status, if we get people in time enough, like, hey, you can start these medications to make sure that you stay healthy. We're still going to suggest you have to talk to your partner about your status.
But you can only suggest it.
You can only suggest it. There's no anything that we can say like, hey, bro, you might want to, we can't do that. It's still up to that partner because, once again, going back to the HIPAA, we'll get in trouble. Our agencies will get in trouble. And, there will be financial consequences that's there long past a relationship.
So I know it's a area of acceptance that an individual would have to come to. Okay, I have this. I know I have this, and I know there's a path to getting to acceptance.
Right.
But what would cause, or what is it? Is it anything about the medication that would cause someone to stop taking it?
Well, if it's having an adverse effect on somebody, then that could stop them from taking it. A lot of the medications, in reference to somebody who is HIV positive, a lot of the medications, if you think about in the 80s, when we grew up in the 80s, the medications that were there, people were on 30 and 40 pill regimens, and that was a lot. Now we're at the place where people can take a pill or have a shot or 2 shots, and that's it. So going from a time period of a lot to a little is something that helps people with adherence. But if there are financial things that's involved, if there's insurance, there's still programs that are available to help people to try to stay in care. There are organizations that help people to stay in care. I know for many of the organizations that deal with prevention, they have linkage programs to help people once they have been diagnosed, to help them find medication, to help them find housing, to help them with counselors, to help them to talk to partners about what's going on as well. So there are systems in place to try to help the challenges that are out there, because there are challenges, especially if you're a person of color. There are challenges, especially if you're somebody who doesn't have the financial means. There's still things that can be done to help people to stay in care, but they have to want to do that. And so you start dealing with like mental health issues in many cases. If people have mental health issues, it might make it that much harder for them to recognize, hey, I still need to be taking this medicine. Yeah, I'm undetectable, but I still need to be doing those things to stay that way. It's not a one pill and I'm done. It's a, hey, I'm taking this medication to stay healthy and to keep my partner healthy, if that's what the case is.
I just find it odd that rightfully so, he's in prison and going to serve some time in prison. We will prosecute a person for not telling, but we don't force a person to tell. That's kind of retarded to me, and I feel like that's a legislative thing that needs to take place in order to clean up some of this. Because this is the closest case that I've been to, but there have been other cases, where, like you said, it happened even in your own family, where it is a stigma. And the thing I love about Karen is, as devastating as the situation with her mom is, she always tries to relate to the patient. because she was like, well, I can imagine. And that's a lot of grace, a lot of grace. And so I feel like she's a great advocate for, y'all need to team up and we need to do some stuff.
We gonna
what I mean?
do some stuff. We got this.
To kind of put and help push that narrative, because it is a stigma, and we do understand having something that once you release it out there, and people, oh, look at her, and or she's, stay away from her or him or whatever the case is. But how do we make that better so that hiding isn't the option? Because right now it's the only option unless you get caught.
Right.
And you get caught, they'll prosecute you, but they're not going to force you to tell your mate you're infected.
That is, yeah.
So we just have to continue the conversation, just like we're doing right now. We're doing something actively to let people know, hey, we understand that you might have a status. We want you to go ahead and become comfortable. Take your medications. See your doctor. If you've got a partner, start talking, start the conversation. Hopefully you started the conversation early enough so a person can make a decision about what they want to. But we have to get back in the community. I feel like COVID took a lot out of HIV and other STDs. People were so focused on COVID, rightfully so, but people started putting other things to the side, not thinking that these things are still building in the community. Syphilis rates are really high in the state of Georgia, across the country right now, but people are not hearing that conversation. So we have to start the conversations. We have to be in the communities, talk to people, let them know what's going on, let them know, hey, as much as we want to think HIV is gone, it's still here. There's still a risk. People want to say, oh, well, you're in Atlanta, so you have to be worried. You have to be worried anywhere. Because these same people that you worried about in Atlanta, they might not be living in Atlanta. They're living in the suburbs. They're coming from other states. This is Pride Month here with Pride Month. So you got people that's coming for different celebrations and stuff. And so they're not leaving whatever they got at home. They're bringing it here. So it doesn't matter where you are. You have to do what you can, we can, to protect ourselves and provide people with information. So we're always talking about education, always providing people with information about condoms, providing things with people about abstinence, just providing people with choices to make sure that they're doing those things that's going to be best for them. Because I can tell people, hey, we got condoms over there, but it's up to you to use them. And you got people who's just like, they don't want to use them. Great, okay, you don't want to use them, then there's PrEP that you can take to prevent you getting HIV. It's not going to work for anything else, but at least you feel better knowing that you're not going to get HIV. But you have to make sure that people are aware. A lot of the commercials that have been done for PrEP, primarily you've seen LGBTQ plus people.
Yes.
But it's for anybody. Long as you are at least 77 pounds, you can be on PrEP. And you don't have, 77 pounds and you are HIV negative, you can be on PrEP. We'll make sure I put that there. I know that one of the local health departments recently has done a commercial for PrEP that featured Black women. It's going to be great when they put it out. It's going to be great because the conversation that people had around when they got a chance to see it was just like, wait a minute, I didn't know that was for women. There's like, and you work in health and don't know that? That's a problem.
It is a problem.
It is.
So if you who works in health don't know that, what is everybody else thinking? So we have to make sure that we're holding these conversations and showing people this picture of, hey, this can affect anyone, but we got stuff that's here that can help anyone. So we have to continue the conversation.
I'm glad you said that too, because I had no idea that PrEP was available for anybody. I mean, do you think the insurance companies will cover that? Say I just go and say, hey, I trust my husband, but let me get some of that PrEP.
So most health departments, regardless of insurance, can find you PrEP either free or at a low cost based upon a sliding scale.
Okay, so it's probably just like the Ozempic, the semaglutide. You gotta have certain things that qualify in order for your insurance to cover it. You gotta have diabetes to get it, unless it. But
when you get a chance to, just look up your local health departments and see if they've got PrEP listed. Most of them should have a clinic or someplace where you, or a contact number where you can call and ask these exact questions to see. It's like, okay, well, you don't have insurance? Great, we'll come by and we can do this, because they're going to hold conversations to make sure that if that's something that you want, that they can get you.
They can feed it.
So,
Yeah.
but your regular MD,
They should be able to prescribe it as well, right?
But I'm not certain that they would be just willing to write you a prescription for PrEP because you say, look, I ain't trying to.
So the challenge that comes with that I know
Yeah.
I've heard was that, first of all, when you're dealing with your primary care physician, how comfortable are you to talk about issues about reproductive health, your sexual health?
Yeah.
If you're comfortable enough, hey, I'm holding this conversation with my doctor. I've got this many partners. I've got this partner. I've heard of situations where doctors talk the person out of PrEP.
Yeah.
Where it's just like, well, you know, you're not at risk. You got the one partner. You don't have to worry about it. Then you have to hold a conversation with your physician, like, hey, I hear what you're saying, but to make me feel better, I would prefer to be on. So you have to advocate for yourself in that regard.
Right.
So being knowledgeable
and
advocating for yourself that this is something that I want to be on. I hear what you're saying, that I don't meet these certain characteristics that you have or criteria, but this is something, I've done the research, this is something that I want to do. And so people have to be proactive about their health and be able to do that, make that a conversational point, make that something that your doctor know that you want to do that.
Because we've done a show on this topic. I think this will be the third time, I believe. We had a lady, Shadon, on the show, and we have our shows on YouTube. Well, someone responded on her show, and she was agitated. She said, I hate when these people say that the medications have you undetectable, but that doesn't mean that it's not transferable. Can you speak on that?
Because I once again, working in public health, you've got some people who is just like, who don't. Let me start with saying this. Any medication that anybody can be on can cause side effects. Let's do that. Any medication that you can be on can have, if nothing is 100%.
Right.
So if nothing is 100%, there's always a percentage and there's always a chance.
Yeah.
Okay.
So I will say that in reference to, I said it earlier, if people are adherent, it should not transmit over. But once again, is everybody adherent? When I say adherent, are you taking your medication as prescribed every day?
Yeah.
And if you're not doing that, the likelihood of transmission increases with each time that you're not doing what you need to do. And once again, even with PrEP, if you are not taking your medication or not going to do your follow-ups, the risk goes up every time that you have sex with a partner. So you have to do what you can to make sure that you are staying safe for you as well as for somebody else.
Yeah. And so there's just not one straight line of medication. If you have HIV, then this is the medication you're going to be in, because you mentioned the pills and you also mentioned injection.
Yeah.
So is one better than the other, or is it just depends on the individual?
It really depends on the individual. You hope that you are in a situation where, your doctor is checking your labs to make sure that it is not affecting your body some other kind of way.
Okay.
So one medication might be better for you than another one. So just in reference to, once again, going back to PrEP, Descovy versus Apretude. Before you can get to the injectable, you have to make sure that you can take the pill form before you get to that.
Okay.
So it's the same thing with other medications. They're going to try and see what's going to be the
So they're
things work.
experimenting, basically.
Right.
Yeah.
All medicine is a
Right,
practice.
Right.
But the thing is, like, you stop taking your medications, you increase the likelihood that your viral load is going to go high. It's going to increase the likelihood that that virus that's in you can mutate, get used to that medication that you slowed down or stopped on, and now you might have to get another dose or an additional dose.
Did you say that?
Or have to get another medication because that one is no longer working.
Right.
So it's up to that individual to make sure that they're doing what's supposed to be done. So in reference to the case with your mom, was this person on medication at any point
I have
in time?
to assume that he was on medication because he's actually had the disease, the virus, since '96.
Okay.
And
So he was on something at some point in
he's been
time.
on something at some point in time. And what we believe is that he wasn't consistent with his
Okay.
medication.
I want you to speak to those who, we're going to flip it a little bit, because we know what your stance is when it comes to the patient. Speak to someone out there who has and knows their diagnosis, but they're not doing what they should be doing, and caring for not just themselves first, but those around them.
Yeah. If you have the diagnosis, it is your responsibility as a human being to honestly share that diagnosis with your partner. It needs to be a discussion had, because at some point you were a victim yourself. So try to prevent other people from becoming a victim by sharing with them your diagnosis, even if it's just to, let's go get tested together, and then you can share with them at that time if you feel comfortable and explaining your diagnosis to them. But it's really important to share that and save a life, because you were a victim once and your life is saved. You're still living and thriving, and someone else can do the same. So it's very important to put yourself in someone else's situation.
Yes.
And be honest and have an open conversation.
Open. Absolutely. William, close us out with, now you just shared how to contact the health departments in our local areas, but talk to us about preventative measures. Let's not even get there.
Okay.
Share why it's important to test. If PrEP, how would we know PrEP is for us? Would just a random person just go and get PrEP? And also just kind of encourage us to just be responsible in all of our dwellings when it comes to sexual health.
Okay. First and foremost, the only 100% way to make sure that you don't get any STD, including HIV, is be abstinent. We understand that does not work for everybody. That's fine. You want to play, make sure you're bringing all the right toys with you.
Yes.
And by toys, it might be PrEP. Anybody can be on PrEP provided that they are HIV negative, at least 77 pounds. It's as simple as, like I said, talking to your doctor, coming to the health department, holding a conversation, and seeing if PrEP is going to be for you. Understand that if you decide to get on PrEP, it's not just, hey, I got the pill and I'm gone. It's, hey, you're getting a blood test. We're testing to make sure everything is working properly. Hey, you're going to come back in a few months to be retested, see how the medication is working. Great, you can adhere to this. You want to move from pills to an injectable. You seem like a good candidate being able to do that. Beyond that, there's condoms. You have internal condoms, external condoms. You have dental dam. You have a host of different things that can be a barrier to prevent. Because understand that when people say sex, people automatically want to assume that it's vaginal penile sex, but there's oral sex, there's anal sex, and all these are methods of transmission for STDs.
I was gonna say, a dental what?
Dental dam.
Okay now.
It's a latex sheath that goes over the orifice, whether it is for vaginal or anal.
Wow.
Or you can put it over your mouth and have fun. I'll put it that way.
Dental dam.
Dental dam. But there's internal condoms, which is also known as female condoms.
Yeah.
Those can be used for anal sex or for vaginal sex. Can put those in on from right before you have sex up to like 6 hours. So people can have the spontaneity. A lot of times people are just like, well, if I stop and put on a condom, it's going to ruin the mood. If you've already got it on, you don't have to worry about that. So there are many methods that people can use that come by the health department. The health departments provide condoms for free.
Yeah.
Dental dams for free. Lube for free. And so even when you start, hey, I don't want to use condoms, you can use lube. Lube reduces friction. And if you don't have friction, you don't have those microscopic tears that can provide that. But I tell people, just in reference to HIV, if you don't come in contact with one of 6 fluids, you're fine. Those 6 fluids: blood, semen, vaginal secretions, anal fluid, breast milk. Did I say anal fluid? Okay, I'm missing something. Oh, pre-seminal fluid, which is pre-cum. If you're not coming in contact with one of those, you're not at risk of HIV, because you still have people that think, well, if I spit on somebody, will they get HIV? No, that is one of those 6 fluids. HIV, out of all the STDs, is the most difficult one to catch. When you have STDs that are skin to skin, like herpes or HPV or even syphilis in the first stage, HIV is a breeze in the sense of you're not going to just get it from just touching somebody. So understanding that the 80s thought process of I'm gonna sterilize, I'm just gonna throw these forks out, I'm gonna burn that toilet seat, that's not where we are now.
Okay. I can only speak for myself. I have not ever utilized my health department in my county.
Right.
And so this is going to be something for me just to go to the website to see everything else that may be available as well.
But you want to utilize it because, like, even if I'm a person who loves to eat out, I love going to restaurants. Those scores for the different restaurants, you can find that there. I mean, something as simple as I need a birth certificate, I need a death certificate. It's so many different programs that make up a health department that's just there that a lot of people don't consider resources that they are there. So please make sure you check out those.
Okay.
Go to the state website as well. It's a lot of information that you'll be able to see.
Definitely, I'm definitely going to check that out. And before we sign off, I want you to share your social media handle because Karen gives updates on her mother's case, and we want to be able to support that. It's not all about, making money off of social media. Social media is also a wealth of good information. You got to research what you get off of there. But it exposes you to different areas of education. And so make sure you follow Karen you do it mostly on TikTok, right?
Yeah, I do it on TikTok and Facebook. Not a lot on Instagram because I don't know. I just, it's not for me. Yeah, exactly.
So what's your handle for?
I'm Karen Young, Karen Jackson Young on all of it. Karen Jackson Young. And you see my smiling face.
So this has been great. We're going to actually do this again. This is like I said, this is a platform. I want her to be able to utilize my platform, and that's my way of supporting her in this quest.
And I really appreciate that.
Oh, I love you, girl. And it's for Denise. Bottom line is for all the love for Denise. So thank you guys for hanging out. Until the next one.
Yay.
Thank you.
Thank you.
See you guys.
Trish Standley TV show.
I would like to thank my guest today, William M. Carroll Jr., for coming and joining us and really educating us on being able to use a tool that is in our community that I know me personally, I was never up on and aware of, which is our health departments within our counties. So make sure you look yours up and find out what they offer to you and your family. And I am so happy. I'm celebrating with my girl Karen and her sisters Tammy and Kush on the arrest and the indictment of Brody, who was arrested for the murder of Denise. And so we're excited about that. Make sure you go and connect with her on social media so you can keep up with the updates. I'm going to update you as much as I can here, but make sure you follow her on social media because she gives more meat. But I thank you guys for joining us. HIV is something that is definitely still prevalent in our community. So you guys be safe, protect yourself. We need you here. Your families need you here. As I always sign off, love isn't love unless you give it away. Love yourself first and then love others. Take care, guys.
This is the place. This is the place.